What we put it as a set of volume.
Beyond the set, no?
Beyond, yeah, it's unexpected volume. It's not set by our side. It's error. Okay, now just to confirm it, this is our prescription now. Okay, here we can follow the protocol. Yes. Here we have 70 kg patient, right?
Yeah.
Okay, just we'll go to the protocol.
Blood flow of 100 at least it will be.
Yeah, for 70 kg patient, we have here 70 kg, blood flow 120, dialysate 1200, replacement post 500, and this is the dose will be 35 ml per kg per hour by this case. Okay, just we'll follow it. We'll go to the blood, make it. Anybody want to do? Yes, please. The blood will be 120. Okay. Okay. Dialysate 1200. Usually dialysate is 10 times the blood flow.
Okay.
Dialysate 10 times the blood flow anytime.
And the replacement?
The dialysate.
10 times this is equation, I mean in the citrate.
Only citrate, no?
Yeah. On the citrate. Yes. Yeah.
And replacement?
Replacement?
500.
Yeah, 500. We'll go to replacement first.
Yeah, it's already pressed.
Yeah, okay. 500. Exactly. If we need to patient fluid removal, we can put, for example, 80 ml per hour, whatever.
But we can go 100 to 50.
Anything, what you want. It's up to you. Okay, put anything.
Confirm.
We agreed that
And the
if
citrate, it
patient-
will calculate it alone.
If the patient is acidotic, still I can increase the dialysate over this score.
Yeah, you can increase it a little
But
bit,
the
10%
dose will
more.
be
or
more
what.
than 35.
That's
30
fine.
Yeah, it means we'll increase the
Increase
dose.
We
Yeah.
initiated in the same.
With the dialysate, no issue. We can increase or decrease as per the patient needs. Here, you can observe one
The
thing.
filtration fraction.
Filtration fraction here, you can find that it's higher than what we know. We know that it should be less than 25. Here, it's okay.
30.
You can accept up to 100.
Yeah, if it increased till 30% or whatever, no issue, because no clotting will happen because we have
Citrate.
citrate. This is the difference and give us more
Confidence.
more confidence. Exactly.
And the citrate dose, the machine will calculate it alone. Then it will be the pre. That pre will be calculated by the machine, or
Yes, it will be same like the dialysate, I think.
but before we used to put the pre.
No, don't the citrate dose. It will follow the blood pump.
The blood flow.
Yeah, we will not put the citrate.
So it's something
Citrate,
like
it will be automatically by the machine. Don't worry.
if the blood flow 120 is 1,200.
Yeah,
so it's 10 times.
Try to increase it to 130. Citrate dose increased.
Increase. So it's
10
10 times the
10 times the blood flow. But it's automated by the
But it is
machine.
automatically by the machine.
By the machine.
Can we
now
go
remaining the
back
calcium dose.
Okay.
to the
Okay.
previous screen?
Okay. I will bring it. But just here, only this is the second page for citrate dose. Citrate dose by default is 3 millimole per liter. Calcium composition
100%.
by default is 100%. And hematocrit is what we entered at the beginning. Okay?
Confirm.
Yes.
Confirm.
Everything we'll keep it as it is at the beginning. We'll not change the citrate dose.
Hematocrit, this is part of the default?
No. We entered at the beginning, the first page. As a patient.
IP code we enter after that. Confirm.
If we need to view the solutions, we can go to the solution again to check here. Anticoagulation, citrate calcium, prisma citrate. This is a composition, calcium solution. This is to review, your review. And continue, confirm.
So in this screen, the calcium dose will not come here. The calcium dose.
It will come in the minute in the.
The calcium, the machine will take care of infusing the calcium to the
By
patient.
100%.
The question is the solution concentration, how much is it?
No, we have to put it from the service menu before starting. Before starting, we have to put the concentration of the calcium that what you are using before starting.
But
After that,
these things, how it will
yeah, the
be
machine
decided.
will give it 100% until you decide to decrease or decrease by 10% or 5% as per the analyzed calcium level.
And where is the option in the machine where we can decrease?
Yeah, it's coming. It's coming. No, it's coming on the next. Anticoagulation risks. Warning: citrate anticoagulation can result in metabolic acidosis, alkalosis, and calcium imbalance. Consult physician for specific risk due to increased citrate load by mistake or citrate accumulation in disease state. This is a risk or some precautions that if we are giving citrate
why
dose,
acidosis? You said that the citrate will change in the body to bicarb, so it shouldn't cause acidosis even if the citrate dose is more.
if I decrease the dialysate flow too much,
Okay.
it will go to the acidosis. Estimate patient citrate load about 11 millimole per hour. This is like this estimation as per all the previous inputs. We are not doing anything, just
Do we have
information.
limitation for this load?
Nothing mentioned on that, but let me double check on that. But just it's a calculation from the inputs that what
I
we
understand,
put.
but if there is a limitation generally for
Estimated
toxic
patient
oxygen,
citrate load.
levels,
According to the patient acid, pH, I mean, or any.
Let's check in the protocol. Okay, we'll check if there is maximum for citrate load or not. Okay, and continue. This is an overview. What we did, all the prescriptions that we did: blood flow, pre-blood pump citrate, dialysate, replacement, post fluid removal, citrate dose from the other side here, calcium composition, calcium solution, all the things. This is overview of the prescription.
Just review. This integration. What we have to monitor. I mean, to know whether we
Just
are
to
going
assure that the prescription is as per the protocol is right. We didn't put any value by mistake, for example. Yeah, this one it's not 90 or the dialysate here it's not 800. Just to check it's aligned together.
But this, we don't need to monitor the filtration fraction or.
Yeah,
like-
just keep it in your mind. This 30%, okay, in citrate is accepted, but in the normal CRT not
TMB
accepted.
also, we don't need to monitor here.
Yeah, we monitor everything in the mini screen. We just will.
But I mean, it's not expected to go up or.
Yeah, once we follow the prescription or the protocol, everything
It's
it will
not
be.
expected to rise.
Yes,
And
exactly.
the filter duration, so it will be the
It should
same
run for longer
72
time.
hours.
Yes, it
Or
should
even
run.
longer or 72
No,
hours?
maximum 72 hours the filter life. Okay. 72 hours the machine will give you a message to replace the filter automatically. Yeah. Continue. Okay, now step 2, connect our patient. We have, okay, we can use this.
This is other patient.
Yeah, that is the calcium of the patient.
Just we will use this bag as a patient. No. Okay. Sorry. Okay, here. What we have to do? For patient connection, we have to clamp 6 clamps and unclamp 6 clamps after chain. Yeah. Just we can assume that this one is our patient, okay? Still, this one is hanged with the saline bag.
Yes.
Okay? Clamp all Y lines and axis, effluent and return lines. Actually, it's 6 clamps. Okay? 1, 2, 3, 4. Don't clamp the small one.
Yeah.
Don't clamp the pre-blood pump one, please. Don't clamp it. This white one. Don't
Many
clamp.
times happened. That's it.
Many
Yeah,
times.
that's why.
Many
In
times.
different hospitals.
Even here.
Here also. Many times.
Yeah, we enjoy too much.
We enjoy too much clamping.
4 here, 4 clamps here.
Remember, there are 6. 1, 2, 3.
5,
Except the white one.
6.
6. And except the
6
bag.
clamps. 4 here on the Y connector and 2 on the effluent bag. Okay. Second step, remove the axis connected with the catheter red lower lobe.
To the patient.
But
To the patient.
Okay.
Disconnect the return
Return.
connected to the
To the
catheter of the patient.
Okay.
Remove the blue,
This right. With this
Blue
one
already
you
you
can
kept it.
connect
remove the yellow, the effluent line connected
Connected
with
to the
effluent
effluent bag.
bag and unclamp the 6 clamps.
Okay.
1,
1, 2,
2,
3, 4, 5, 6.
yeah, just I will use this one. I will use this one as a catheter of
Yeah,
the
yeah.
patient. Okay. And we can assume this is our patient again.
Yes.
Okay, 1, 2 there, 3,
3,
4, 5,
6.
6.
That remains the
Okay,
same.
يبقى here clamp all the lines, it means 6 clamps. Disconnect axis connected with the patient. Disconnect return blue line connected with the
Another.
patient. Disconnect effluent line yellow connect with the effluent bag.
Now,
Connect the dedicated, this is one extra, new option here, or new instruction. Connect the dedicated calcium line to the patient, secure line in clip. Okay?
unclamp all
Unclamp
these things.
all the clamps. All those clamps, unclamp it. Here we have clamp also on the calcium line. This one is new. Okay? This one it will be on the, you can keep it on the patient side if you want. This clamp. Okay. Thank you. This is the patient side. Be careful with the needle. You can keep the clamp here on the near the patient, and you can just clamp it. And once you see unclamp, just unclamp this line also for the calcium. Okay?
That will be
All
the
the
last
lines
clamp.
be the last clamp. And continue. Before continue, if you want to change the fluent bag by empty one,
Sorry.
now
We are
the
going to
step
start.
If you wanted to change any bag, this is a fluent bag. If you did mini priming or you repeated the priming and it's a little bit it's full
Yeah.
by fluent, just change bag, remove the scale, remove the fluent bag, empty it
Empty
or
it and you can
replace,
start it.
attach, and remember to unclamp the lines after you replace
Yeah.
any bags. Okay, everything is okay. Just continue. And check and ensure that pre-blood pump access line is unclamped. Access and the return line are connected to the patient catheter.
Yes.
Clamps on patient access and return lines are open. All unused fluid lines are clamped. If you are not using any line, you can clamp it. Like now the syringe line.
Syringe, yeah.
We are not using, and yeah, we clamped it, this one. Because we are not using
using.
heparin or systemic, we are using this original. Okay, and
Start.
So blood 120 and 3 is 1200.
I will tell you some changes between CRT and the calcium citrate also on the main
For
page.
example, if I want a bigger dose for the
Okay.
for the dialysis, I mean for the replacement, for the post. So if I
We
increase, I
did
should
it,
reduce the
okay.
dialysis, I mean to maintain the same
Good evening.
57
Uh,
kg, or it's not necessary in this situation, or
For the new one.
like, for example,
No,
I will tell you in CRT what I am doing. If I want to increase the replacement, I have to reduce earlier the post. Like I have to maintain the
One
same
idea.
total amount.
Oh, നേരത്തെ പറഞ്ഞ
يعني here in the CRT we prefer to obey the protocol, the table, to not change it too much the dialysate and the replacement more than
But this we
the
are changing according to patient need. For example, I want
Yeah,
creatinine is not coming down,
yeah.
so I need a bigger dose.
You can if you want, but you have to remember one thing. The dialysate it's calcium free, but the replacement is with calcium, with other
So if
composition.
I'm increasing the replacement, that means I'm increasing the calcium.
Dialysate, if you decrease the dialysate, okay, if you decrease that, you will decrease the bicarbonate, okay, and the patient will be more acidosis.
Okay, so I have to follow this dose. It seems I can't change.
Yeah, return this connection. Okay, just because we don't have pressure, this one should be some pressure because it should be catheter. I will apply some pressure here to simulate like the real connection.
You can clamp. The clamp will be.
Yeah, I just partial. I'm doing. Continue. I'm trying to partially to clamp the lines because we are simulating do same like the patient. The catheter of the patient is make some resistance, but here's the free lines, no resistance. Okay, now we have prescription. We have anticoagulation. Prescription. Take photo for the prescription, and this is anticoagulation. Wait. Okay. For the prescription, we can go to adjust.
No, you can adjust all this.
Yeah, what we have to adjust in the prescription of the fluid, the blood flow, the dialysate, the replacement, but no pre-blood pump. Why?
that
because
is
once
Citrate.
you change the blood
Automatically it
flow,
will increase.
the red blood pump will be automatically, it should be 10 times the blood flow, 10
So, I
times.
mean,
That
according
is
to the
fixed
breed,
like a blood flow.
Fix it.
like
Now the machine is giving the calcium to the patient.
Yeah, automatically, 100%
You
composition.
started without checking the dose of the calcium in the patient and the post filter, صح?
Now we started, we will take
We should
two samples now.
before pressing or now just now.
Now, once we adjust the blood to circulate
Right
it,
now.
yes, take first. Okay. Now we start the blood detected now.
Taking all of this time, we should have checked the patient and the blood from where you would check the blood here.
Yeah.
Here, post the filter
Okay.
from the circuit and from the patient,
That one.
red one.
the axis, the red one.
So blue
Okay.
and blue.
Let's assume that we find the patient 1.4 and the circuit is
Yeah, let us check the table.
Just to see an example.
Okay.
Ionized calcium.
What's the result?
1.5.
For
we find the patient 1.5 and the filter 0.1.
Okay. Let us take this report. Okay.